02. Hospitalized patients in Middle Tennessee is 235, and in Davidson County is 147. Deaths to date are 849. So far, 137,708 Nashville residents have received the first dose. That's more than 21,000 from last week. That now equals 20% of the residents in our county who have received at least one dose of the vaccine. And 73,158 of our residents are fully vaccinated. That's 10% of our county residents. This coming Saturday, we'll take another step to increase those vaccinated by hosting a drive-through vaccination event at Nissan Stadium. And all 10,000 appointments for that have been filled. Rachel Franklin will provide a brief update about the mass vaccination clinic in a few minutes. We're making great progress on vaccinating our residents 65 and older. In fact, among all of those 65 and older in Nashville, 62.5% have received at least one vaccination. Furthermore, 53.4% of whites over age 65 have received the vaccine. 43.9% of blacks over 65 have received at least one vaccine. And 55% with people of Hispanic ethnicity over 65 have received their first shot. We will open additional slots for the next block of appointments at Music City tomorrow and on an ongoing basis. Appointments can be made by going to covid19.nashville.gov, or you can call 615-862-7777. And remember, vaccines are available at other locations as well in our community. This includes healthcare systems such as Vanderbilt, the VA, Nashville General, TriStar Health, and Ascension St. Thomas. Also included are federally qualified health centers, Meharry Medical College, pharmacies around town, including Walmart and Kroger, and each has its own method of becoming registered. Finally, a word of caution about spring break. Schools are out and beaches are filled with students and families. COVID case numbers are high in a number of these beach areas, and the virus can spread even on crowded beaches. Please protect yourself and others by socially distancing, wearing a mask, and getting vaccinated. Davidson County assessment centers are open Monday through Friday, so those returning from spring break or those who have any concern, please get tested and isolate yourself until your results are back. It would not be a surprise if cases increase over the next few weeks as a result of exposure during spring break. Now, Rachel will talk about this weekend's vaccination event at Nissan Stadium.
Good morning, everyone. The big event is happening on Saturday, starting at 6 a.m. We have all 10,000 slots registered for a Johnson & Johnson vaccine. It will be a drive-through event. We have 700 volunteers throughout the whole day, 350 per shift. We are asking for folks who did register online to carpool where they can. We're also asking folks to come as close to their appointment time as possible. Appointments are scheduled in 15-minute increments, so we're hoping no one shows up more than 30 minutes ahead of their appropriate appointment time. We're also asking folks to wear shirts that can easily have access to their upper arm for the vaccine. We are hoping to keep this running as smoothly and efficiently as possible, so all of our planning efforts have centered around making sure things can go off without having to take long times to do anything, obviously. We will stop vaccinating at 7 p.m. Or until all folks with appointments have been vaccinated. And I'll answer any questions that you have.
Thank you, Rachel. So if you would, y'all are all muted, but if you have a question, please raise your hand and I will call on you. Gotta put my glasses on. Let's start with Yoon at the Tennessean. Can you unmute her?
I can.
Good morning, Yoon.
Good morning. Thank you all for your time. About this weekend's mass vaccination event, has there been any duplicates, signups that the health department has seen during the past week? And, you talk about, 10,000 spots being filled. with the potential maybe people not showing up, at that 7 p.m. mark, is there the potential for extra doses? And will there be a special standby list the city's looking at for that? And how would that work? Or would that not be the case with the Johnson & Johnson shots? I'll let you answer that before moving on.
Thank you.
So as far as leftover doses, we actually have a plan starting in the last hour or hour and a half of our vaccination day to make sure that we keep on point of how many vaccines we're drawing up versus how many cars are in line to avoid having any extra doses. So there will not be a wait list for this event. We hope to have no extra doses by the time all scheduled appointments have been vaccinated. As far as the duplicates, we did delete duplicates. We went through, contacted folks who have been who had duplicate appointments, confirmed which appointment they wanted, canceled the others, and then over the last few days, we have actually focused on our underserved populations with those open links and been able to fill about 300 of those through those efforts.
And we fully expect to have all those slots in the 10,000. We hope to see all 10,000 folks on Saturday. Next question is Julia Palazzo at Channel 2. Good morning, Julia.
Hey, good morning, guys. Just a couple of questions. I know traffic is probably going to be a huge concern for everybody. Can you just talk about plans about, just the road closure surrounding Nissan Stadium and just trying to get traffic through smoothly? And I know that there was a call for volunteers from you guys. Rachel, I heard you mention we have 700 volunteers throughout the day, 350 per shift. Is that how many you have signed up, or that's how many you're looking to have? Like, how many do you guys still need?
Okay, thank you. So as far as traffic goes, the main entry point for those getting vaccinated will be into Lot A of Nissan Stadium from the Woodland Street Bridge, and Metro Police will have signage and folks directing traffic into the area. And then, of course, once you get into Nissan Stadium, we will have traffic controllers. We believe that we can start queuing cars probably 15 or 20 minutes before 6 a.m. So we're asking folks to not show up any earlier than about 5:45. That will allow our volunteers to get in place with the things that they need to do their job and get the morning started off well. What was the second question?
Do you have enough volunteers?
Oh, for volunteers. We are still looking for a couple of dozen of volunteers with healthcare licenses. We unfortunately have had some folks that have had to cancel their volunteership over the last few days. So as far as non-medical volunteers, we are good to go there, but we're still needing about 30 or 40 volunteers with healthcare licenses, which we did post on social media yesterday. So hopefully those will start coming in.
Thank you. Up next, Stassi Almost.
Hi, guys.
Are you there?
Hi, can you hear me?
Yes.
Go ahead, Stassi.
Is it working? Hello?
Hello. Stassi, we can hear you.
All right.
Could you mute Julia, please?
With the volunteers, the need for volunteers is beyond this Saturday, correct? You guys are doing multiple Saturdays, and then you also mentioned that you are planning on opening community-based mobile clinics. Can you talk about the plans to open more clinics as well as the need for volunteers?
Yeah. Thank you for the question. Yes, we're going to continue to need volunteers. We've been using Hands On Nashville to supply volunteers for Music City Center. That will continue. That is an ongoing endeavor. We're nearing, or in the next week, we'll be at about 1,500 new doses per day there, plus the second doses. So yes, we need volunteers there. We are working with community events, and while even Saturday we are doing a large event at Nissan, we're doing a smaller event at Lee Chapel, and then also partnering with Neighborhood Health on a small project with homeless individuals. So also running Music City Center that day. So We do need volunteers. We're just going through Hands-On Nashville for pretty much all of that.
Next question, if you want to mute Julia and Stassi.
She's done. They're done.
Next question is from Peter White. Good morning, Peter.
Good morning, you all. Thanks for doing this. I have a question not about your vaccination efforts, but about testing. Could Dr. Wright talk a little bit about surveillance testing and with schools reopening and maybe different kinds of tests in operation or whatever? Could he comment about how Davidson County is going to be hopefully doing a better job of monitoring when people get infected and how to, find out who they've been in touch with and that sort of thing?
Sure. Schools has worked with Meharry and has developed a testing program. The health department's been only marginally involved in that arrangement. We have looked at it, but my epidemiologists are the ones that have been closely involved with that. I have not. We continue to have testing at all three sites: Nissan Stadium, the prior Kmart out in Antioch, and then at Meharry Medical College. And we will, and the plans are to continue for sure with at least Nissan Stadium over the long term. We're continue to reevaluate the sites otherwise, but at this point we have all three sites open and testing. The number of testing, or the amount of testing, has gone down. And luckily, we've had a really good improvement in our overall percentage of positives. I think I said 3.7 today. And so we continue to do that. I think we've done a good job of doing testing. And we're not the only place that's testing. I mean, hospitals, doctors' offices, et cetera, are also doing testing. So I think we've done a good job in that regard.
So I don't see any other hands up with questions. I will tell you that we will send shortly, probably in the next 30 minutes, a media advisory with a whole lot of detail about Saturday's event, specifically for you guys. There are two hands up?
Yeah.
Who's up?
Ian?
Ian, do you have a follow-up question? Let's unmute
If that's allowed, that would be great.
her. Okay, sorry.
I was curious with the transmission rate, being a bit higher, just kind of any details you can share about that, and if the city has seen any new cases of different variants of COVID.
Right. So variants, we know we've had a few cases of the British variant. Haven't had any confirmed cases of the other two variants here in Nashville at this point. I think it's reasonable to expect that those variants are, at least in the overall geographic area, whether they're actually here in town. We've seen them in Atlanta and other places, so there's no reason to think that they won't eventually get here if they're not already here already. We are continuing to have about, I think we were 1.0 or 0.2 today. And so that basically means that the spread is really 1 for 1. So each person infected passes it to one other person for that transmission rate of 1.02. We'd like to see it lower, continue to work with that. Vaccinations will help that. But again, people staying socially distanced, being outdoors when they can instead of indoors, wearing masks, washing hands, all of those things that are important. And then, of course, getting vaccinated when it's your turn are important to helping get that transmission rate down.
All right. You muted her. Okay. Stassi, do you have a follow-up question?
Yeah.
Okay. Go ahead.
Volunteers getting vaccines after kind of the day is over. I've heard here in Nashville, some volunteers have actually gotten the vaccine as well, despite their qualifications for the current phase. Can you talk about that, as well as can you clarify? You said in your numbers that last week we vaccinated 21,000 people. On your social media, it said that you had scheduled 30,000 appointments in the last week. Can you talk about where that maybe 9,000 is at?
So the 21,000 is the total all across the county. That means all the healthcare systems and all of those. The 30-something thousand, I believe, includes the ones that have made appointments for the Nissan event as well.
Yeah, that 30,000 would be for the next 2 weeks. It's kind of a rolling 2-week number, and it would include Nissan. What we're having currently scheduled is 1,000 new appointments a day. That increases next week. Trying to remember which day, but anyway, next week it accrues to 1,500 Monday to 1,500 a day for new appointments, and then we'll have follow-ups or second doses, and that's just at Music City Center. So I think that's where that number discrepancy is it's a 2-week number that we're using versus, or that is in that.
All right. Now, this time I don't see any more hands. If there are any other follow-ups.
Oh,
Wait a minute.
go ahead.
Okay.
Volunteer vaccines?
I'm sorry.
Stassi?
Can you hear me?
We are offering vaccines to volunteers.
Okay, the vaccine
they're
for
volunteers,
volunteers?
Yeah,
Yes.
we do
Can you talk
offer.
about that?
Yeah, if we offer them to volunteers, it's usually long-term volunteers that are coming back routinely. And when they do that, we're usually doing that with somebody that's at risk, but we're also doing that at the end of the day to use up any vaccine so it doesn't go to waste. Usually there's only a few of those, 2 or 3, and then also if there's other additional doses, we do go to the standby list also.
And Julia, do you have a follow-up?
Yes, really quickly. Are there official plans for another major event like this, the one Saturday? Or do you think it's just going to be one and done, and then it'll just be getting people in Music City Center and mobile testing, partnering with local hospitals, et cetera?
At this point, we don't have another plan for another large event like this. I think we want to get through Saturday and see how that goes. I do think we will have some smaller, more focused events. Again, we're going to try and focus those upcoming events more out in our communities that have less ability to travel, and our minority or refugee communities where we can, so we can get the vaccine out into that community that also needs to have vaccine available.
All right. Now seeing no other hands, going back to what I was saying earlier, I'll be sending out a media advisory in the next 20 or 30 minutes, and it will give a lot of details about Saturday's event. It's specifically for you guys on coverage. It will include a map. We also are working on, it may not be ready yet, but we'll have a post on Metro's YouTube channel on the actual flow on how that's going to work. And so expect that in the next 20 minutes. And seeing no other questions, just want to say thank you for as we work through the bugs on doing this. And we will plan to do another press update just like this on Thursday of next week, same time, 9:30, and we'll be sending out that advisory Wednesday evening. So thank you for joining us. You're welcome to text me if you have any other questions. Thanks.